So our surgery is located in Dublin 13. It's dedicated to hair transplant surgeries only, and we have the latest in technology available to us. So we don't use any sedation on the day of surgery. This means that the patient can actually drive to us and drive home after surgery. Yeah, it's a very streamlined, straightforward treatment. The surgery is done efficiently and effectively on the day. Recovery is very quick. It takes max a week to recover, but after a few days you're well on your way to recovery. Very easy and not as invasive as people might think it is. Patients often remark to us how straightforward the process was for them.
FUE is a method of extracting hair grafts for hair transplant surgery. The surgeon usually extracts grafts which he or she thinks are suited to the transplant they're trying to do. So you can choose between 1 or 2 or 3 hair grafts individually and use them at whichever area in the recipient area that would suit. So single and double hair grafts towards the front, triple hair grafts towards the back of that particular transplant. It's probably the more recent method of extraction of the hair grafts. It used to be another procedure called strip or FUT, which surgeons did to actually remove the hair grafts. Again, we would consider an area at the back or the occipital region of the head as the donor area. That area would also extend out onto the temporal area or the side area too. Most people would try to confine the area from which they remove grafts so as to avoid removing from an area which may not be permanent in the future, to not go into areas that may be subject to balding later on in life.
We would see a number of patients come in, and I suppose the main thing on their mind is, how many grafts do I need transplanted? Now this is determined by their donor area mainly, depending on how good their donor area is, how many grafts they have, the quality of their grafts, what the recipient area is. We have to match up the donor with the recipient area and get a balance between the two. You can't have a donor area left patchy with bald patches, just so you can get a huge number of hairs in the recipient area. So it's all about balancing one with the other, and we aim to get the best balance between the two. FUE involves shaving the head, then adding local anaesthetic into the donor area. The donor areas are mapped out into sections where the surgeon will extract individual grafts from each section sporadically so that we don't deplete the donor area completely. He will extract enough grafts in the donor area to place into the recipient area for the transplant. So the procedure is completely pain-free. Once you get the anaesthetic, you will not feel anything throughout the whole day. It's like going to the dentist. Once you get the anaesthetic, you don't feel anything at all.